one, and some of our own medical staff are meeting with our new hires as soon as they're hired, talking about medical care and mental health care. You can never overteach on a subject like mental health, and the more we can do, the better our staff are, the better our population is in the jail, and then thus again, when they return to the community, the safer the community is going to be. I'll pass.
I'm just thinking of it too from the perspective of an individual entering into a correctional space and the state of mind that they might be in. I mean, this is a pretty significant transition that they're experiencing. Entering into a place, there are a lot of unknowns. There are going to be natural fears that are present there for them. Medications that they normally might be taking or would want to take maybe are not available in that immediate moment. A place of instability, right? An individual walks into a place that's, safe certainly, but there's really, from a mental health perspective, it's a place of instability. And so I think, mental health symptoms can be exacerbated certainly in an environment like that. And as we think about, like what Jake was sharing as well, the emphasis on training and understanding what we're seeing. And I would expect that we're gonna observe and notice behaviors in different individuals. That's the first thing that we see, is we're gonna see behaviors, and we don't stop oftentimes and ask the question, why is this behavior present? There's always a reason for that specific behavior. And so having the opportunity to really think through what's going on in this individual's life, which is hard in the moment, because there's so much happening, there's such a high level of complexity in that type of space. And I think though, before judgments are made, before labels are cast upon individuals, to recognize that this is a tough space for those individuals to be in, specifically around the mental health symptoms that they're experiencing, and to recognize that and to be able to, not see it as necessarily confrontational, because that's oftentimes what those behaviors might, be presented as, is they're, it's being confrontational or it's resistance to kind of what's expected of them in this space. But recognizing that everybody comes in with a story and have been impacted by their previous experiences, the impact that trauma has on an individual, you cannot overstate that, specifically with this population as a whole. And so, we've been able to focus and have some training specifically on the topic of trauma, recognizing that it's so important to be able to see people for who they are as a human being, rather than just a label that we so quickly and easily throw upon them.
Yeah, those are just great thoughts. Steve has me thinking differently, but I think I just kind of relate it back to not being siloed to the stigma as it exists in the correctional facilities, but also in our communities, people who are justice involved. Thinking of easily labeled criminals, felons, and we use a lot of that language. I think that's one step, we as a community can take is being aware of our language around people who are justice involved, and humanizing them. I think whenever we put labels on people, it's an attempt to kind of create some distance, and that's them and this is us. And we see that in mental health as well, and working to better our field in that area as well. If somebody's not schizophrenic, they have schizophrenia. Just how we frame that up really does go a long way. So, Chris, I know you have more thoughts.
I'm not sure you want me to have this. Yes, stigma is a problem, but you're right, it's not a jail problem. This is a community problem. This is a societal problem. But until we can start treating mental health issues the same way we treat medical issues, because get this, mental health is medical health. There's not a difference. It's a chemical imbalance in your brain. And until we can start having conversations openly about them, the stigma is going to remain. When somebody tells you they have cancer, you start talking to them and you start saying things like, well, is it treatable? What type of cancer do you have? Are you going to do chemo? Are you going to have radiation? Is it operable? There's communication that you talk about the actual issue. When somebody is depressed or suffering from a bipolar disorder, those conversations don't happen the same, because we don't understand it, we don't know it, we're uncomfortable with it, whatever the reason is. And until that changes and we can start treating mental health issues as medical issues, that stigma is going to be there in the community. And if it's in the community, it's going to be in a jail, right? Because the jail is just a small microcosm of what your community is. I think you brought up the issue of deteriorating while you're in jail. And a lot of it, if you're not reporting it, because I don't want to be labeled, and the data that we collect is self-reported, don't want to be labeled, I'm not going to say anything, and so could I deteriorate while I'm in jail? Sure, absolutely. And if I do report it, there are protocols in place in every jail where that person is kept separate, right? You have what everybody calls segregation, right? That's a disciplinary issue, and that word has a negative connotation. But there's also administrative separation. There are reasons that you would not have somebody in general population, and some of that might be, depending on what their mental health issue is maybe it's not safe for that person. Maybe they're vulnerable, or maybe they're assaultive, or whatever the reason is, they get separated. And so you can very easily have somebody who's in custody in a safe environment who can still deteriorate while they're there. And that's an issue. What do you do with that? Okay, well, there's education, there's training, there are resources that can come into your jail and that you can provide, but again, resources are limited. So reducing the stigma, I think it's a community problem. If there were TV commercials out there talking about mental health as often as they're talking about the water in Camp Lejeune, then everybody would know, right? But you can't turn TV on and not hear about how bad the water was in Camp Lejeune, and you hire an attorney. But we're not doing that. And until that starts to happen and we start being comfortable with having those conversations, the stigma is going to exist in our communities and ultimately in our jails. So I'm going to shut up again.
I want to add one more thing. So in front of me, I've got our inmate chronicle. So this is written by those incarcerated at Dakota County Jail right now. And does everyone know what month it is this month? There's a lot of things happening this month, but yeah. Mental Health Awareness Month. So our inmate population wanted to focus on that. So this is not me talking, this is one of our inmates that are currently in custody. There are numerous avenues we have here at Dakota County Jail to address our mental health concerns. If you need to talk to someone, you can kite, which is basically an email, mental health on the kiosk, or you can seek out a deputy who is CIT certified, which is Crisis Intervention Team, and have one-on-one conversations with them. There are also numerous podcasts available to the tablet on the tablets specifically geared towards mental health and wellness. Open up the podcast and click mental health, and you will be able to see anxiety, depression, trauma, self-esteem, meditation, happiness are a few of the selections. Currently on the tablets, it's been stigmatized that it's weak to express our emotions or to talk about our feelings within the walls of jails and prisons, but it's not at all. Get that stuff off your chest and out of your head. Reach out to somebody. Journaling is another positive outlet we have. All you need is a pencil and some paper. So that's one of our inmates in custody. And so we're talking about breaking down the stigma for our inmate population. This is one of the amazing ways we do it. And any person in custody can get this and read it and explore it. And it's a constant effort, as we've all have said already. There's always, when you see that finish line out there, as soon as you get to that, the finish line grows because there's more that needs to be done. So I'll digress. Anybody else?
That's some thought-provoking stuff, and amazing that you guys do that in Dakota County. Probably helpful for a lot of folks there. I'll put a pause on some of my formalized questions and open it up to our community and our audience here. Does anybody in the audience have a question for any of our panelists? Anything online?
No.
Okay. Well, if any time, I'm going to continue with some of my questions, but if at any time anybody has a question, just go ahead and raise your hand and we'll call on you if something comes up, because again, there's a lot of great information coming out here. So my next question, open to the panelists, will be, how can we improve the transition of individuals with mental health issues from correctional facilities to community mental health services.
Anybody? I feel like you want to say something.
This is one of those questions too, where just it's kind of under this umbrella of there's a lot of community agencies and resources that want to do more, but with Medicaid being suspended for individuals who are incarcerated, it really limits our ability to in-reach and make that connection, because we know that earlier intervention with that does make that transition more successful. So that being said, I think coordinating as much as you can with your partners. I think it's one thing that's unique is that our systems don't really work together seamlessly. Fair. And so I think it does take a lot of kind of creative solutions with our partners to understand what our correctional partners' capabilities are, what their limitations are, and when and where we can make some adjustments on our end to kind of make this fit. I know our team is exceptional at creative solutions, and we can't get the referral, we can't get as much information, the referral that we want, but we can get A, B, and C, and we can work with that. So I think it really takes creative solutions and really growing to understand your partner's correctional side and mental health side, what their strengths, where they can be, and how it can be the most efficient.
So you brought up the loss of benefits, which is a big deal. Benefits get lost, which prevent non-governmental organizations from providing services because typically they're in the business to make money. When somebody loses Medicare, Medicaid, Social Security, all those are cut off when they are arrested and brought to jail. It makes it much more difficult to, one, reestablish those once they get released, but two, provide services. There's actually a constitutional right for medical care when you're in the custody of the county. You and I sitting here do not have that constitutional right. When you go to jail, the county must provide services, but they have limited resources. And I believe you brought this up earlier, is a medication that you may be on in the community. When you go to jail, that doctor may transition you into a different medication for a number of different reasons. I would hope not just revolving around money, but a lot of times it is. This medication is cheaper, we're going to start you on this, even though it might not be as beneficial to you. But a lot of the decisions that get made are based on the amount of resources that are available. So the question was transition from the community back in, or excuse me, from the jail back into the community. And I keep, I don't like going back to the well every time, but a lot of it will revolve around what resources are available in the community. In outstate Minnesota, resources to provide mental health services are not as prevalent as they are here in the metro area. And so trying to establish relationships with these mental health providers who are in some cases hundreds of miles away is difficult. Another difficulty is data. There are data practices out there. Medical data is private. Unless you're going to sign a release of information as the inmate, and unless you're educated and told here's why we need you to sign this, now we're not going to be able to share information with somebody in the community, with a provider in the community. Same way, the other way around. If there's not a release of information, the jail is going to find it very difficult to gather medical data on you to provide you with the best services available. And so I think some education and some training, again, between those two pieces, the correctional community and the mental health community, and to make sure there's communication between them, we're not siloed, that we can get that data, those releases of information, and we can share. Because without it, okay, now we're pretty stuck, and all of a sudden you move from the community where you're doing okay to a jail where you're not, and then back to a community where, well, let's see how bad it gets before it gets better. So I'm going to leave it at that. We can keep going on it, but I don't want to keep going to the resource well.
I'll piggyback off something real quick. Like Chris was saying, the person coming into custody, I just want to touch on this real quick. That person that's coming into custody for whatever crime that happened, if they were arrested, a lot of times what I've seen over the past with people coming into custody is they don't know how to take care of themselves or are not taking care of themselves when they're out in the community. And so then when they come into the jail, now they have those resources that are mandated, that we do provide those things, and which is good. We want them to get stabilized. We want them to be well. We want them to return to the community well. But correct me if I'm wrong, if any qualified mental health practitioners out there or people incorporated, 7 diagnoses, mental health, before they typically figure it out. Anybody know? Any head nods? Nobody knows? Okay. I read somewhere in some book somewhere it was 7 diagnoses before they actually figure out what is going on with a human being. And so that could be 7 jail visits before this person finally really figures out what's going on, and then they actually get the right meds, the right therapy, and the right treatment in order to be at their normal to return to the community and be productive. I just wanted to touch on that.
I guess too, I think we've been talking about mental health care, and I want to, when I say that, I'm thinking of maybe a broader scope. I'm not sure that our community sees that. But so just the numerous barriers that individuals release with. There's housing insecurity probably before they went in. If there wasn't, there's certainly is now. Food insecurity, transportation issues. Maybe they don't have a license or now don't have access to a car, whatever it may be, so now there's employment issues. So when we're working with individuals, there's just a great amount of complexity with that, and stabilizing some of those basic needs things. We spend a lot of time and effort doing that, because if they were stable before, they're certainly not now, and they usually weren't necessarily before, and so we have even greater kind of hill to climb with them in that process, and that's a huge barrier. And if our team's watching now and I don't mention housing, I don't know if they'll forgive me, but it's the most difficult part of our job is finding somebody safe, secure housing so they can start that journey. And yeah.
I agree 100% with Casey.
All right, we'll move on to the next question, and it was loosely touched on, and I think in the journal that had been written, but if there is a formalized peer support program within the jails, what role do they play in promoting mental health and well-being among the incarcerated individuals?
So with the Corrections Integrated Support Program, we do have peer support specialists that work with individuals even while they're still incarcerated. And there's incredible power and lived experience in being able to connect with individuals on that level. And even from the previous question too, just about mental health issues, it's nobody wants to be told, I think this is mental health related. Like, I think there's a mental health illness here. That's a hard thing for a person to hear and for a person to accept. And yet I think it's important that we have an opportunity to normalize this, that this is so common and so prevalent, and it's okay to have a mental illness. And so I think peer support, the role of peer support is so much about helping them be okay with where they're at in life right now. Being okay with the substance use that they're struggling with, being okay with the mental health symptoms that they're having challenges with, instilling hope that things can improve, and that where they're at right now, they don't have to stay there, that they can be at a different place, they can accomplish goals that they have for themselves. And peer supports have lived that out. They've been at that low point in life, and they've been at that place of struggle, and still are in many ways, yet they're able to take individuals alongside with them to say, we're going to a better place, and to be able to have that opportunity to instill hope. And I think that's a huge thing. And to get to that individual to a place of acceptance of their reality in that moment. Because if you're not at a place of acceptance, it's hard to progress forward and to move to where you want to go. So I think that's a huge part of what they can do.
Does anyone not know what a certified peer support specialist is? Everyone knows what that is?
Sharing is.
All right, I'll let one of the humans that know more than you.
So it's an individual with lived experience. And so they're in recovery, and that's for peer recovery specialists and peer support specialists. They're a little different. I don't need to get into that, but somebody with lived experience, and then they go through some training to help support others who are going through crises as well. Yeah, I think in regards to engagement, the peer support role is invaluable. You mentioned the 7 diagnoses, but I think the point is that it's not a linear track for a lot of people. And being told, I think this is mental health related, and I think these are the steps you need to take, is sometimes difficult to hear, and it's definitely difficult to act, take those next steps. And so a peer can really be there if somebody's in, that ambivalence, and really just be there in that space and sit with them, and no judgment and a level playing field, and can work with them through that. So I think that's something that is really valuable in this field, as engagement's key. We can't do what we do if people aren't engaged, if people aren't coming to see us. I also think the peer role in general is adds tremendous value to the teams, whether that's correctional staff or mental health staff. Again, this us and them, kind of, these are our patients and we're the clinical team. Peers really bridge that and make it a little bit more, we're all kind of in this, and it's also such a privilege to go to work every day and know that hope is possible, because you work with people who have done this and who are on the other side of it. So I think it adds value on many different levels.
Just quick to add to that too, I was thinking of, so I'm a mental health therapist, licensed mental health therapist. That's kind of my background. And so I have a bias towards it. I think everybody can benefit from therapy. But when we think about individuals that we're working with, criminal background, the trauma they've experienced, the levels of just the symptoms that they're experiencing as well, making that connection with them to say, hey, I think you could benefit in meeting with a therapist. The common response is not, hey, that sounds fantastic. Let's get that set up, right? There's going to be a natural resistance to that as well. I've seen it over and over again. Individuals who kind of, whoa, that's like pretty intense. That's a pretty severe response to kind of what I'm experiencing. I'm not sure I'm quite ready for that. So again, peer supports, the specialists, they have that opportunity to begin to make that connection between some services that are available to them, yet there's a strong resistance to accepting or wanting to be a part of their own life. And so I think that's a huge thing, because I know without a doubt that virtually everybody that we're working with can benefit by meeting with a therapist, but there's not buy-in to that yet. And so peer support specialists can really help in that process of not only identifying what's available for you, but I really think that as it's been helpful for me, it can be helpful for you as well.
So I wrote down a couple things that the panelists have said, because they're smarter than I am. Reducing stigma, learning coping skills, increasing hope, helping inmates feel less alone and more supported. Those actually exist in jails, in every jail I ever inspected in my entire career, but not as mental health. Every jail out there has an AA, an NA, or an Al-Anon program which provides all of this for substance abuse, but I'm not aware of any, other than Dakota County now with People's Incorporated and a couple others that have started it. It would be nice if you could provide all these things, the hope and the coping skills and the support and feeling less alone. If we could get all of that in the mental health capacity, that would be terrific. It exists, we can do it in jails, but it's really not being done. So I think that's something that jails could certainly look at providing, in the same way. Now, it's peer driven, and it relies on volunteers. So some barriers there, but I don't think it should be something that's unable to be overcome. We can do it for substance abuse. Why can't we do it for mental health issues? And to be honest, a lot of times those run parallel anyway.
Maybe last thought on just this one. I have a quote from my jail resource coordinator, Morgan Napoleoni. So this is her words, not mine. I can talk all day to our folks, but I have never sat on their side of the desk. I can't relate to them on that level, and that piece is very important. I'll echo everybody's thoughts on when you have that certified peer support specialist that has lived experience in mental health, addiction, going through the criminal justice system, sitting in front of you and saying, you can get through this. You can. Here's how I did it. Let's get through this together. I can only imagine that takes a weight off that person sitting on that side of the table.
And just one last comment too is lived experience leads to compassion. And I think ultimately it's about compassion and showing compassion to those who could benefit greatly from that. And we have non-peer support specialists, we have mental health practitioners and therapists on our teams as well. And one thing I so much appreciate about the teams, the corrections integrated support team, is they are filled with compassion. And that speaks so loudly. And so really it's not as much about the role, it's really the ability to show compassion to those who desperately need that.
That's great. And this will be the last question that I'll have for you. I'll play right into it. But say we know that we have the need for some of these mental health components within our correctional facilities. What can we do to ensure that incarcerated individuals have access to it? And even when there's overcrowding or underfunded, when the correctional facilities are underfunded, how do we deliver those services?
This one's tough. This is really tough. Right now, amongst law enforcement in general, speaking for Dakota County Sheriff's Office and our correctional side of things, we're understaffed. We've got correctional deputies working overtime constantly, constant call-outs to fill that overtime. And so, we have that basic need of just running the jail that we struggle with at some times, just with human beings, to work the housing units, to work booking, to work intake, to work release, control. And so, at the back of all of our minds is the people we're serving inside the jail. And we know that the more we can give, the better mental health treatment, the better medical treatment, the better food we can give them, the better programming we give them, the safer of an environment it is, the healthier the environment it is, the better outcomes of the environment you're going to have. And so I can speak for Dakota, we are always striving for that. Everything we do in our jail is pushing towards that finish line right now. And when we get there, again, we're going to keep moving the finish line and keep doing more. Our partnerships are huge in our facility. People in court, our community corrections partners with our reentry assistance program, our social workers and social services that are doing their part, our employee economic assistance group people that are doing their part, our workforce center people that are doing their part. You have to build those partnerships, and no matter what county you work in, no matter where you work. If you can't build those partnerships and figure out a way to collaborate and communicate effectively, your populations is going to suffer. And so having that be the focus and continue moving forward is the best advice I can give.
Ditto. You said a lot, and I wrote down partnerships. That's probably the biggest piece. Partnerships with mental health providers, partners with faith-based organizations, other community resources that you have. I think that's a big piece, is to bring those people inside the walls and have them help those that are incarcerated. Train your staff. A lot of people that go into corrections aren't getting educated on mental health issues, and they may now, as it is starting to evolve. But back when I went through school, mental health wasn't something that we got taught. And so, if you can train, educate the staff, provide resources to the inmates, and make sure that they know and are aware of the importance of asking for help. It's kind of, you have to do both sides. Train the staff, educate those that are incarcerated, and involve the community. So, could have just left it at ditto.
Ditto as well. And I know I'm just kind of this black cloud with funding, but the problem I have with this question is ensure. How do we ensure that incarcerated individuals have access? And really, it's difficult to do that without some structural components in place to ensure that that adequate resources are there when they're needed, and that we can ensure that they're there consistently, and that that structure is there. So I agree with everything Jake has already said, but I think ensure is difficult for me. I think there's a lot of piecework we can do, and there's a lot of people working really hard to make things fit together and to make things work and to do the best we can, but to ensure sustainable quality care as required funding.
Question from the audience.
Yeah, I have a question. When we talk about ensuring the future of how we work with these individuals, and I'm thinking long term here, what's the case for our young folks to come into mental health, the mental health and wellness field, as well as into the justice field? So they are trained, so there are pathways, so they are trained coming in. What's the case for our young people over time to come into the field prepared and ready, so we can ensure the future service in of how we work with folks, human beings, as you say, with Frank, these folks who end up in these situations and in these environments.
Yeah, go.
Were you listening to me earlier?
Oh, yeah.
Sorry.
I had a conversation probably, I think, before you got here, and maybe if she's okay, maybe she can actually talk about it, but otherwise I'll summarize it. It's up to you. There are programs in place, People Incorporated is one of them, that actually has I'm going to call it a mentorship type program, where they're bringing kids out of high school and providing them with education and training while paying them to provide services and move them into the mental health field. And that's just one instance that I've heard of. And I just heard of that today. So it's a great question, it's very timely. I wouldn't have known the answer, I wouldn't have had this in front of me if I wasn't here a little early talking with their staff. But yeah, I thought that's a very out of the box way of thinking about it. In a world right now where everybody's having difficulty with staffing, this is a way to move young people into the field and actually have resources available, because that is one of the issues. It's not just money. There are not a lot of people that are going into the corrections field, but there are even less moving into mental health. And so I thought this was a very initiative and bright idea to bring forward and to go to these young people and give them that mentorship while paying them, providing with the education and training. And it's not a formal master's degree type thing, but it can move them in that direction, and maybe they end up doing that. So I thought that was a wonderful thing that People's Incorporated is doing.
Maybe I might refer to you in the Peace Board standards a little bit. Can you just quickly touch on what the new legislation for like CIT training and that kind of stuff has been put in place over the last couple of years?
Yeah, as a lot of folks might know, the training just in law enforcement, just as in corrections, has really evolved over the last several years, and that's with great need. I think a lot of the calls that our officers are going on have a mental health component. And we discussed a little bit about CIT training within the correctional staff, but that's also occurring out in the field with our police officers as well. So much to the point where the post board who governs our licensing as police officers is starting to mandate some of that training. Now, metro-wide, there's a lot of police departments that are already doing that proactively, very fortunately for our communities, but it's become the standard. That is something that everybody should be trained in, and that's a 40-hour training class that's based upon de-escalation and being able to communicate with those in crisis, and that is ongoing and continued. And again, back to our inner collaboration of we want to make sure people are well when they're coming back out into the community, because unfortunately, we're tied, oftentimes between the police departments and the correctional staff. But with help from People's Inc. and folks like that, we also have embedded social workers in our police department, with some of our collaborations, and I think we're starting to close that gap, a little bit, so great question.
Yeah, and I really think the colleges and universities are also catching on to this with the law enforcement degrees and the criminal justice degrees, and there are components now where they are focusing on mental health in those more traditional paths of education, which is great. We have
In earlier pathways?
Say that again?
Earlier pathways?
Are you talking like high school?
High school?
I wouldn't know. I couldn't speak on that. Yeah, I don't know. Does anyone know anything? But that'd be certainly something cool to explore. We do an Explorer program through Dakota County Sheriff's Office, and I know we touch a lot about that with those people that are going through the Explorers program with that team. But more, if you're looking more specifically like the high schools, I couldn't speak on that.
And if I could I follow up just a little bit? One of the, because creating these pathways is a part of my work, and I think it's a part of a critical concern of the community, is we talk about these stigmas around going into corrections and going into mental health. These could be some of these places where some of those stigmas, we begin to break some of those stigmas and help to open up the mind and the spirit to going into this pathway.
Absolutely.
Something to think about.
Absolutely. Thank you. We appreciate that.
That's great. Thank you to the panelists, and I'll conclude by calling Jill back up and take her place.
Well, that was an awesome conversation, am I right? You think we should continue to have these conversations? I absolutely do. You know, it is sometimes feels like a very small scratch on the surface of a very big barrier, right? But we have to remember every step we take forward, every partnership we forge, every new idea that we have, every little thing that we take, every little step that we take makes a difference. It gets us closer to that goal of improved community wellness, to that goal around equitable access to services and care, that really important step to make sure that the individuals, those vulnerable individuals that are out there, that are to, I think one of the comments made of how many times they are ending up moving through a corrections environment. If we can reduce that churn by 1 or 2 or 3, it's a huge, huge change for that individual and a huge opportunity for them to re-grab their life and their potential and think about how they can move forward in a very different way. When you work in the mental health field, probably much like the law enforcement field, you tend to really focus on small victories. Because small victories make bigger victories, and it has to all start somewhere. The work that is being done, that you all spoke to today, of course the work that Casey and her team are doing in People Incorporated, the awareness of what we heard from our moderator around just thinking about how we talk to each other, how we train each other, how we prepare in different ways. These are huge. These are steps that are going to create down the road huge opportunities. That the goal is to keep talking about it and to keep working it. As far as the workforce, this is a big deal. 100%. It's a big deal for us as well. But what I see is a community that has a lot of individuals in it right now that are desperate to be change makers, are desperate to make a difference, and really reach out there and say, you know what, I want to be part of a collective conversation that creates better wellness. I want to be a part of a collective conversation that helps us all to understand each other better. These are really important things, and honestly, I love that you brought that up, because we need those folks to come and have conversations, because if they choose to work in this area, mental health, corrections, what they truly have the ability to do is to be choosing to be that change maker in their own space. They get to choose to drive sustainable resolutions that benefit everyone, and they get to create improved community wellness. So, gosh, I look forward to the next conversation. I kind of wish it was tomorrow, but I'm suspecting everybody's busy. So thank you all for coming. Thank those of you who joined us online for the live stream for joining us in this conversation. I think I can safely say that we will continue the conversation, and that we will look forward to inviting you all back again sometime down the road to continue that. I want to thank certainly our CIS team at People Incorporated, because this is a position that came with a fair amount of need for the individuals that did the work and those that were managing the work to have two things. One, a deep comfort with ambiguity in learning, because it requires us to learn from our partners to be able to create the best solutions, and a lot of grit, because it isn't always easy, right? It's not always easy in moving into a different system. So the work of our CIS team is extraordinary, and I want to thank them for that. I also want to thank our panelists, not just because you were panelists today, but also the conversation. You know, it's much easier to say, well, I don't really know anything about this, or it's never going to change, or, you know, it is what it is, right? We hear that all the time, but by virtue of the conversation that you all had today, you said, hey, I'm going to be a change maker, whatever that means. I want to thank all of our panelists from Ramsey, Dakota, and Anoka counties, as well as our moderator, Deputy Chief Joe Adams. Thank you for the thought-provoking questions and conversation, and please say hello to each other before you leave, and have some food, because there's plenty left over. Thank you so much. Thank you.